Hello, my name is Alman Shibli, and I'm a second-year student and MBA Fellow at the Center for Digital Strategies at the Tuck School of Business at Dartmouth College. I'm pleased to welcome Shub Debgupta, CEO and founder of Wiser Together, who is joining us today as part of the Brit Technology Impact Series. Welcome to Tuck, Shub, and thank you for being here.
Thank you, Alman, and thank you for having me.
So I'd like to start out with a discussion about Wiser Together, which you founded in 2008 and where you currently serve as CEO. Can you tell us a bit about what you do for your customers and how you got started with the company?
So I founded Wiser Together about 6 years ago when my wife was pregnant with our first daughter. We now have 3 daughters, but she was pregnant with our first daughter, and she was a difficult pregnancy. And we were struggling with one of the test results that came back, and it ended up being a false positive, but it got us thinking about how do we make decisions about further testing, about genetic testing. And that was really hard for us. My wife's is a professor at Georgetown, another economist. I'm an economist by training. And what we were looking for was the right information that will help us actually make a decision, not just information for information's sake. There's a lot of it out there, but actually something that would help us, influence us, guide us to actually make decisions. And we found that that was lacking, not just in healthcare, but also on the web. Mm-hmm. The web was designed more in a 1.0 kind of world where it is more informational as opposed to actionable. And with technology costs falling, with the power of data being more and more apparent, I was able to put the two together and come up with a decision tool that actually combines people's information, their preferences, their medical situation, and their financial situation, and actually help them put it all together and make a decision in one of the most emotional and complex situations in the world.
Great. So you work with, as you mentioned, health plans and Fortune 500 companies, and that is you access customers through those channels. And if I understand correctly, so you guys are basically providing options after a patient has seen a doctor, or could it be anywhere throughout the process, or is it kind of? I mean, I guess my question is, you're still seeing doctors. This is just kind of after you've received information, a way to sort through that information.
Right. Great question. So we sell our product, or we sell our services to companies who actually carry the risk in healthcare. So individuals, while they bear a significant portion of the cost these days, and it's increasing, the majority of the cost, about 80%, in some cases even 90% of the cost, is borne by the insurance company or their employer or the government. And with the new ACA healthcare bill, a large number of organizations, even providers, will be taking on some of that risk. Mm-hmm. So what that does is the focus is really helping both the patient combined with their payer and their provider, all 3 parties in the health ecosystem, make a better shared decision.
I see.
So our tool is provided to the individual through their payers.
I'm kind of curious of, first of all, how have doctors reacted to your service? We
do not replace the doctor in any way. And what we are doing is we're helping the individual identify what are the most important elements in their choice, okay. And find treatments that they can then share with their doctor, prioritize their treatment list. So think of us as eHarmony for treatments and patients. The patient on average has about 22 elements that actually matter to them when they're evaluating a treatment. This is treatments where they actually have a voice or a choice. This is not where it's acute care or terminal care where the doctor actually makes decisions, and rightly so. But this is where you are living with the treatment or living with the condition. You have to fit that treatment back into your lifestyle. Mm-hmm. So preferences do matter, and that's the focus of our product and our service. We focus on preference-sensitive health conditions. And what we do is we help people identify of the 22 elements which ones matter most to them. For some people, cost matters a lot. For some people, effectiveness or speed to recovery matter. Others, side effects may be an issue. So we help you prioritize and then find people who actually have been through this treatment before, people exactly like you, what worked for them, what didn't work for them. And that allows you, and that gives you confidence as you think through your options, that this is the right selection for me. You've got to take that we help you match that with your doctor and tell your doctor this is the list that works. Doctor will identify, is this the right list, or is this something that we can reprioritize? But what it does is it helps the doctors and providers understand where you're coming from. It focuses the conversation, makes it a much more effective experience. And what it also does is, because it's a match between you and your treatments, you're more likely to stick with them there's low trial error, and it removes a lot of the inefficiency in the system.
Great. I think kind of the recommendations and the input that you provide back to patients would be highly dependent on data. And you mentioned that outcomes are fed back into the algorithm. Can you talk a little bit about kind of how you obtain the data that creates kind of the initial algorithm, and then if you do feed any patient data back in, kind of how that whole process would work?
So as I mentioned, the patient actually is influenced by 22 elements when they're making a decision. And those 20 elements break out into 3 buckets. First question is really, is it work for me medically? Does this treatment work medically? Is it things such as, is it evidence-based? Is it, what are the side effects? How is it effective? There are about 6 elements in that bucket. The second one is once they check the box on this is whether it works medically or not, does it work financially? So what's covered by my health plan, what's out-of-pocket costs, what's the specific, do I have to take time off work if I need to do surgery, for example? Number of elements, what's covered by your health savings account, about 5 elements in that bucket. And the third element or third bucket that people care about is really, will it work for me personally? Things such as what do peers do? What are peers' experiences here? What's the pain or difficulty of the treatment? There are a number of personal elements that come in. And all these elements matter. And individuals are constantly evaluating them as they think through their options. This is a really hard thing for in the healthcare for providers to keep track of, let alone track systematically. Our ability to capture that information and be able to provide it to the decision makers, as the individual and the provider, in a way that they can make a shared decision, has been very effective and has been proving to be a very unique solution for the marketplace. We capture the data from multiple sources. There's data around your clinical preferences and clinical effectiveness coming from evidence-based medicine. There is a tremendous amount. Dartmouth's Medical Center has been a pioneer in leading the charge in evidence-based medicine and in informed decision making. And we use a lot of that information into our tool, into our algorithm. Financial coverage, financial information, cost, which is cost transparency, the actual price that providers pay is also factored into our tools. And then personal preferences is captured by the patient, what they share with us. And we're able to capture that in a very unique and interactive way that allows us to then aggregate all this information in a way that is actionable for the individual and then helps them get to the next step.
Great. So it seems like the best treatment options may change from year to year. And it sounds like your solution is highly adaptive to kind of what the outcomes are. Can you talk a bit about how it would adapt to kind of changes in the way the medical community might approach a given problem?
Right. That's a great question. Medicine and medical technology is improving rapidly. In fact, in the last every 7 years, the knowledge of the body of knowledge of medicine and the treatments doubles over the history. So with that rapid development, be it new drugs, be it new devices, be it new treatments, you have to be constantly updating and staying abreast of what's happening, what's effective, what's working, what's not. And we're able to bring that in. Our model allows us to capture emerging technologies, things that are under clinical trial, as long as it's approved by the College of Medicine, the appropriate College of Medicine and the medical community. We incorporate that into our tool so patients very quickly can see this is what the common practice is, but there's these new technologies that are emerging that may be worth reviewing and seeing how effective it is, what's the experience behind it, and allowing them to have that much more focused conversation with their provider.
What do you think the next generation of healthcare will look like? Who are the key players in the field today that we should be paying attention to, besides obviously Wiser Together?
Great, thank you. The next generation of medicine will be about personalization. It is moving from what is personalized at the provider level to all the way down to personalize the treatment level. You see genetic DNA mapping and genome mapping coming to the forefront, and what they call personalized drugs and personalized treatments is one step. But there is a behavioral last mile as well. two people with identical conditions with very similar treatments will have very different outcomes. Why? Because they have different preferences, or they have different situations that need to be factored into the choice process, the decision process. And mapping that entire personalization is going to be key, because medicine can then get to the outcomes that it was intended to in a much more faster, much more efficient way than a one-size-fits-all approach.
Great. So one area that comes to mind, kind of given what you just said, that's gained a lot of attention recently is devices like kind of wearables, things that are tracking your everyday activities. And one could imagine an extension of that into more sensing devices. How do you see that kind of playing out within the personalization of healthcare, and specifically within Wiser Together? Could that be a data source for you?
Absolutely. I think it's a great development, and I think it's an idea whose time is more than needed, has come and more than needed. The amount of data that's generating is tremendous and is escalating every day, every minute. Putting that into something more actionable and useful, and being able to provide it to the different players, not just back to the individual, but maybe to their influencer, maybe their provider or their payer, to the extent that they are able to use it in an effective way, matters. And there will be a series of resources that will emerge, and players that will emerge, who will be able to balance the data with the need, and drive people to the better outcomes. And that's we're going to see a tremendous amount of growth there. There's going to be a tremendous amount of opportunity, and Wiser Together is well poised to incorporate that information.
Shub, on behalf of the Center for Digital Strategies at Tuck, I would like to thank you again for speaking with us today. I'm sure our listeners appreciate your thoughts and insights. This has been Alman Shibli with the Center for Digital Strategies at the Tuck School of Business.